Heart disease has plagued our planet for generations now, leading the world in global mortality rate with a shocking 31% mortality rate. This is the leading cause of death in America. Heart disease affects all ages and genders. It's been incredibly hard for the world of medicine to maintain due to its complex symptoms. Disease has been misdiagnosed as something common as asthma. The UK found out of the 600,000 heart disease patients they had, 1/3 was initially misdiagnosed. These numbers may seem outrageous, but they're shockingly true. And that's why this issue needs to be more important. The importance of this issue needs to be raised. No vaccine is going to help us. We cannot take 2 pills a day to fight back against this life-threatening disease. Fixing our habits, like reducing the amount of smoking we partake in and the prevention of diabetes, is crucial. And that will mean, obviously, eating better and partaking in physical activity. And this information that I've found will be incredibly useful to medical researchers trying to find a pattern in heart disease risk factors. Understanding that countries with higher percentages of diabetes and smoking will clearly show a link to heart disease deaths, as I have proved. This could help them provide countries with more medical attention, possibly even advertise to reduce smoking and unhealthy diets, but even start movements to get laws changed, whether it be the legal smoking age or possibly readjusting prices for healthier foods like fruits and vegetables, like America has done in the past. Now, as I've mentioned before, heart disease will be my main topic here. But what are the 2 variables that I'm going to branch off to? Okay, well, let's talk about that. I'm going to talk about diabetes and smoking. Now, I believe, or I hypothesize, that I can show you that there is a strong correlation between countries having a high percentage of diabetes, high percentage of smokers, leading to a high amount of deaths due to heart disease. So you know what? Let's go look at the charts. If we look at these 2 charts, they're very simple. It's 30 countries, and they both show the amount of diabetics they have and the amount of smokers they have. Very simple stats. Now, you can see there's a couple countries that stick out. India and Russia both have very high percentages in smoking and people who are diabetic. Finland has a shockingly high number of diabetics. But here's the problem. This does not show you anything. But let me show you something that does. Okay, let's start with the bottom left of this graph. Now, as you can see, this is heart disease factors. This is me comparing my 2 factors to my main heart disease variable. If you look at the bottom left, diabetes percentage, low. Smoking percentage, low. What else is low? The amount of deaths due to heart disease. If we move to the right of that graph, as slowly as we go up, as slowly the heart disease deaths go up, what else goes up with it? The percentage of smokers, the percentage of diabetics. Yes, we do have the one outlier at the very top of the screen, the blue dot. That is Finland, but even that outlier goes in our favor, as even with the shockingly high diabetic percentage, they also do receive the unfortunate amount of deaths that I hypothesize will come with these type of stats. Now, I think we should look more at analyzing our graph and looking at external facts. Now listen, diabetics are 2 to 4 more times likely to develop heart disease. 1 out of 5 of smokers also end up with heart disease. Our correlation coefficient, if we look back at our graph, positive. 0.75 for diabetes and 0.866 for smoking. Both of them are positive, showing us that there is a strong positive linear correlation with our graph. The more smoking and diabetics there are, more smokers and diabetics there are, what else increases? The amount of deaths due to heart disease. If you look at the means and medians for both, they're both relatively close to each other, giving us the idea that there are not many points that are crazily off or anything that shows that we are completely off and completely wrong, as low percentages have shown lower deaths and higher percentages have showed higher deaths. If we move on, we also want to talk about the things that can stop you from having to suffer these diseases and the outcome and the negative outcomes. Regular exercise, healthy diet reduces the risk of heart disease by 50%. If you smoke, yes, there is an issue, but there's always a solution using the acronym START. Set a quit date. Tell your friends and family. Anticipate the challenges that you will have to overcome. Remove the tobacco from your house and talk to a doctor about solving your issue. Now, here's the thing. I cannot show you all this data and tell you all of it can be technically reliable. The validity of my data can be questioned. Now here, assuming all data is accurate is a big assumption I must take when researching, though it would be very odd for you to assume that medical institutions wouldn't need to be questioned and they wouldn't be wrong. Human error says otherwise. Whether it be misdiagnosis or inaccurately recording the patient's information, these are all issues that I have to assume are accounted for, but at times are not. Back in 2018, a study estimated that over 250,000 people in the US suffer from unchecked medical errors. If the medical data is right for each patient, even then there's an issue because 1 out of 20 patients get misdiagnosed. One woman found an error in her medical data where she was somehow written to have 2 kids and she'd never been pregnant before. These are issues that I have to assume are being dealt with, but possibly aren't, and that could lead to my statistics being possibly inflated or less than the real values. Another assumption I have to make about my data is that patients are being truthful. Listen, when it comes to smoking, not everyone wants to willingly admit that they take part in this act. A lot actually want to hide it, and I have evidence for that because studies shown done by the respiratory clinic that out of 125 patients, one-third of the patients lie to their doctors, denying that they don't smoke. And that brings us back to our previous point. If patients are willing to lie to their own doctors, how do we know that they're not willing to lie on surveys for medical data? Or if they take it from their medical profile, it's not going to be true, right? So maybe the number of smokers in each country could be possibly wrong again, as they don't want to admit that they smoke. And a last limitation that we face while trying to find health data is sadly money. Researchers of the Methodist University proclaimed to study heart disease, they require larger than the average data set or the average amount of experience, which is already constrained by money, as they need more medical facilities, more test subjects, and they need insurance companies to make sure that patients aren't liable and that they are liable. These things must be paid or made. This is an unfortunate reality about the medical field, as funding is really what stops our growth, as this type of in-depth research and testing requires a lot of money to come up with reliable conclusions. Now, overall, thank you for your time, and this is my presentation on heart disease.